I'm very happy to be here with this group on a reflection and a stock taking about what's called the Urban Health Initiative that we started in the 2015, more or less, as a response when we first realized, and I'll do a small introduction about that. We realized in 2013 that actually the deaths by air pollution were much bigger than we had anticipated, partly because we were calculating indoor air pollution separate from outdoor air pollution, and there was very little evidence on the impacts of air pollution on NCDs, on non-communicable diseases. So there was a massive underestimate at that point. In having come to terms with that, I was working with WHO, with Maria, with colleagues here, and so we decided, well, how is it that we can, one, increase awareness, etc., but two, how is it that we can start something which is concrete and specific, and that can, where we can learn about what model we can develop. And so this session is a bit of reflection on that. I think one of the points which was important for the development is that we had a very useful workshop where a lot of people from this society came. And I mentioned and I praised the contributions for Paul Wilkinson this morning, who was one of the people who influenced and informed, but we brought people from public health, from environmental health, from urbanism, and that reflection led to a proposal, which I think is a very good proposal. That's looking at scenarios analysis, comparing what's feasible and possible in a specific city, and working with local stakeholders to increase demand and to create a vision for the city of what would be possible to do in this place and time that responds to the drivers of air pollution, but also in this specific place, but also responds to the needs, the aspirations, and the dynamics of stakeholders in those places. So there were two cities. We're talking today about one of them, which were the pilot cities. And I'm really happy to be here with the people who have followed that up, because I disappeared from WHO and 2 years later, and still affectionately, emotionally, whatever, engaged with the project. And I believe it was a very good model that was proposed. It was a collective proposal. But I think we're here to hear a bit about what happened and reflections on that. So thank you for inviting me to sit here and to be with you. It's a pleasure. And I'll start by giving Maria, the director of the department, the words, about her reflections perhaps on the project. Maria.
Thank you, Carlos, and thank you all. First of all, and you introduced it so well, so I will not add. I think we need to focus on the presentation, but I want to thank you personally, because what we are presenting today are your babies, Carlos. I don't know whether you did a DNA paternity check or anything, but we are quite proud of the results, and it's because of you we initiated it, so I think you should be very proud. And just to add that you will hear now the presentations, but my point will be that no excuses. We can postpone action, or we can say that we don't have the political willingness to do it, but we cannot use as an excuse that we don't have enough scientific evidence on air pollution or interventions proving that this is work. And what we will be presenting today will reinforce, I think, this argument that no excuses. We have tools, we have very good knowledge now. So the question is, okay, what next, and how we mobilize? And this meeting, this Congress is a fantastic opportunity for that, to create those networks and make sure that we take advantage of the knowledge that has been created. So just thanking you and the panelists, and of course my dear colleagues, and going to the point, because this is very important. And I hope that those who are not enjoying these sessions will hear about it, because it's very important what we will be presenting. So over to you, Chair, and thanks for accepting to be with us today. And thanks for initiating the work more than anything.
Thank you, Maria. And one thing that I didn't say that I think should be said is that the model that now C40 is using for air pollution is the Urban Health Initiative, which I think is, something that to be said about that. I mean, the comparative scenarios, etc. And I think other people have been following those steps. So it draws on collective capacities for modeling and for scenario analysis and for engaging with local levels.
And maybe, Carlos, another point that you are reinforcing, but is that we need to make sure as well that we will not reinvent the wheel anytime. I mean, if we have developed a knowledge, it has to be across and used by others. And so we are very happy with that. Over, I will quick quiet.
Thank you, Pierpaolo. So Pierpaolo Mudu, he's been working on environmental health for many years, on transport and health, and on air pollution and health, and other cross-cutting issues on environmental health.
That is a dirty word in World Health Organization, cross-cutting.
Cross-cutting, is
Usually,
it? I'm sorry
they
for that.
kill you when you do cross-cutting things. They like you working in silos everywhere. That is the production of knowledge happens in silos. This is the last 30 years of work in academia and other places. But anyway, yeah, we have a cross-cutting activity. And I have to thank you. I mean, Maria was mentioning that she was forced to do air pollution because of you. And I was moving this madness also because of Carlos. I started working at WHO the first day. He put me a note about a project. It was crazy project. And from there we start. And I think I'm not going to give you now the results of the Urban Health Initiative. I want to give you the background. I don't think that there is no way that you can understand a project if you don't understand where this project is coming from. So I'm sorry if this is kind of historical, but it's not historical because I have put a lot of notes on the conceptualization of the theory, on the methodology, on the meaning of urban, the meaning of urban health, what we were doing when we started this thing. So I have prepared a background part of the presentation. And the background goes from what Maria and Carlos and a lot of other people have said. The levels of air pollution that we experience in our cities are quite high. But if you see the global picture, if you start going in the details of what are the levels of air pollution all over the planet, there are some parts of Africa, for example, or Asia, that are suffering the highest levels of air pollution. And so I'm giving you why were we in Accra, first of all. And this is a slide where you can see the trends of air pollution that we made a huge work of simulation and work with the DMAC model that is Gavin Shaddick from the University of Exeter. And this is not just the desert dust, but it's a lot of anthropogenic activities that are related to the hot spots of the planet. 2019, that is the latest analysis done by our colleagues in the air quality unit. You have basically the whole 99% of the global population over the new air quality guidelines set up by the WHO, as Maria was mentioning before, September 2021. This is a very difficult situation, and we went there in Accra, I would say, without kind of hesitation. If you see, this is the mortality attributable to air pollution by WHO region. So the Afro low middle income countries region is the one where there is the highest burden for household, and also for ambient there is a significant burden on mortality. We go to a place that is well known as nothing is measured, except for a few countries. I'm generalizing, but if you have questions, I can stop and I can answer the questions. But there is a new generation of scholars, and there are new work that has been done, particularly in the last decade, that give us at least some ideas of what's happening in Africa. I have done here just a very quick summary based on recent papers. So new studies have been published. So PM, now we have some measurements of PM related to studies that are also, they have some epidemiological purposes. And you can see here some of them are, I would say, quite relevant for what we are gonna discuss. But you see also that most of the studies of the pollution, on air pollution, they do not cover most of Africa. And there is obviously a big bias also on this, on the production of knowledge, on the production of information. And this is obviously something that has constrained us, at least when we have to decide where to go. At that time, many years ago, would have been very difficult to go in a place where there were no studies, no data of any kind. We have done something like that in the past, but it's not really what we had in mind. We want to work with the local data. We want to work what was available. And you see that local data, ground monitoring stations, or some kind of stations monitoring air pollution are also rare in Africa. So this is the context where we decided to have an urban health initiative. And the urban health initiative is related to air pollution and climate change. It's related to the policies that are related to climate change and the policies that are related to air pollution. These policies are often are the same kind of policies. And this is just an idea of the trends. Many of us are obsessed with indicators, just every year measuring things, but in reality for air pollution, what it really matters are the trends. There are places where we can measure the fact that there has been an improvement, for example, for household air pollution. And there is also a stable, if not increasing, unfortunately, pollution situation for Ghana in this case, and for Rwanda, Ethiopia, and Africa. So this is the framework where we were moving. And I have brought another couple of slides on air pollution in Africa. This is premature deaths, and you see that sub-Saharan Africa is again the part of the continent that is suffering more for premature death due to PM and also for ozone. I can skip this because it's repeating the same. I brought another slide that I can go back later during the discussion, but it's not just only air pollution. Air pollution is not created just because there's the Sahara Desert or people because are driving cars that go using diesels or very old technology. There's a big problem of degradation of the soil. So this is something that came quite obvious. But this is just a map that it was published before the project that I had quite in mind, because Accra and Ghana was really there in the soil degradation severity part. With Carlos, when we start working, and we had this famous puzzle slide, that this is the way to work in silos. And this is, I'm talking about 20 years ago, and this was still now, I would say that things are kept separate. It is quite difficult to go to an integrated approach. And this is really a puzzle that you have to disentangle, you have to put pieces together. Maybe this metaphor is not even correct, because the reality is much more complex than a puzzle where all the different pieces can go together. But I'm putting this because with Carlos and I think with a generation of people, we developed the tools, we developed the discussion for to pave the road for the Urban Health Initiative. So the Urban Health Initiative has been working not only with a big, I would say, institutional support because of international conferences. I'm not going back to the Stockholm Environment Conference of 1972 that paved the road for everything that happened later. But it's true that we have the Healthy Cities Network in 1980s, in the second half of the 1980s. We had a Rio a conference in 1992. We had a resolution, a call for action at global level for urban health and from WHO in 2010. And we had the resolution in 2015 of the World Health Assembly on health and environment. So this is really something that is okay. We have the institutional support. But if you don't have the tools, if you don't have, I would say, the knowledge to go in a country, you cannot do much, even if you have a lot of institutional support. This kind of information, this kind of knowledge came from a generation of projects that were with the European Commission framework. So we have to acknowledge this, because the European Union was quite clever in putting scientists from all over Europe and also from US and other countries together. We work also with people in China, we work with people in different places. But then there was a moment where what I was showing you, the puzzle, was discussed. What do we do? Do we have the tools to address all these different factors, environmental factors, risk factors? And I have listed here Externi, Harz, Interesse, Ishtar, Pasta, Urgence. These are projects where we discuss the way to build, as Carlos was saying, scenarios. But, you know, building a scenario, I agree with Carlos, it means to have a vision, but then you have to operationalize that vision. You need to have a way to understand what's happening, what if. And I'm showing very quickly how this can be done based on the experience of the European Commission, the projects of the framework that we were, the fifth framework and the sixth framework. We had one project that Carlos initiated that was quite crazy. The idea was to build one software, just one software, able to do everything for air pollution. So dispersion modeling, concentration modeling, exposure assessment, health impacts, and the impacts on monuments. So we had a big group of engineers, and they were there with the idea that we can do a software, and they even produced the software. But this is not really probably a feasible way. I mean, you end up with something that is very difficult to handle. I can go back on this if you want later, but there is another way to do this. Instead of having one software, a huge software, you can have a loose coupling of different software. So for the dispersion model, you use one software. For the concentration, you use another software. Health impact assessment, you have another software. And then you link all of them. This is loose coupling in software way of speaking. This is another way. And all these kind of projects, anyway, brought the necessity to have tools. And tools are needed not only for understanding how to deal with reality, but also to do field work. I was involved for 3 years in a project where we had to assess the impacts on health of petrochemicals. And it was a field work. I had to go there with engineers. I had to take measurements. I had a budget that it was not big, but I could do research. I could do biomonitoring. I'll show you what we did with the colleagues. And industrial contamination is much more complicated than air pollution. You have thousands of substances. You need to know the life cycle of the industry. You need to know the anthropogenic activities of a place. So air pollution, in a way or another, we simplify our lives, and we have some indicators. We have the PM, for example, and then we use NO2 or ozone. Industrial contamination is something a little bit different. There is air pollution, there is soil, water, and the food that is contaminated. The areas where we work were in Sicily, and it was a place where we had the possibility to run with different groups, international groups, a lot of different investigations. We had a lot of pressure from the industry. There was a lot of discussions in the place where we were doing the field work. But at the end, what I want to show you is the fact that here we are in the south of Europe. We had the possibility to run different investigations. We can do a lot. And in an ideal kind of case, you end up with doing all these kind of activities that I'm listing here. So you have bioaccumulation of PCBs, occupational core studies, interviews with privileged witnesses and non-privileged witnesses, review and analysis of available information, and review of literature, risk perception survey. You can do all these kind of things. This was something that I think is important to understand, because once you have this kind of complex project, you need to have an idea of what you're doing. And with this project, we explore again on the fieldwork how far we could go, also in testing tools. We will have a session on tools in a couple of days where we will have hands-on on some tools, and the idea of understanding how WHO is working on developing not only software, but the idea of a tool that is something a little bit more advanced. But I want to show you this project is a fieldwork where we could go at the level of putting together more than 20 studies, and each study could feed another study. This is a network produced with Pajek, the software, but gives you an idea that each study was supporting the other study. So I would say that this is along the work that we have done, an idea that how far we have gone in Europe. And then we have to move to another reality. And the reality is that you have a lack of data. We will go back on this. And the reality is that you have to make use of the data that are available. And so we start from understanding that air pollution is a big issue in Africa, but we have modeling giving us the data in most of the cases. We have some monitoring station in Ghana. We will see what we have done with that. We have a huge development of modeling that has happened in Europe and North America. And then there is a new, something new that was happening also. There was citizen science, and we have this discussion a long time when people were starting for the first time measuring air pollution. And this, I think, goes later when we will have a discussion, because citizen science poses a lot of questions about environmental problems, environmental issues, and even democracy. So the possibility of many different people to measure the environment where they are. This is my last slide, because I will go back on this slide later in the discussion. It's a slide where I have the cover of a report from the World Bank. We had the director here before. She mentioned that they have a portfolio with billions. And they made in 1995, they made a study of the waste management of Accra. And they used $70 million. That is the equivalent of $140 million now. So now it's double. Just to give you an idea, solely for solid waste management. And the second study that I will go back on this in the discussion later is about urban equity and urban health with the case of Accra. And it was I really like this study because it was done in '97. And they say literally exactly what Carlos and me and the others were doing. We use the data that are available. So this is what you have. We make the best use of what you have. And this is 1997. It's very, very interesting for people that work in Accra or they're interested in what happened along the decades. I think it's interesting. And I think all these discussions, all this background of knowledge, all the gaps that we have in our knowledge, all the bias that we have, the fact that we have to work with hundreds of different people, it is a big challenge. But I think it's very interesting now to have Cristina and Abe to present what happened then in Accra when the moment we started working there and what we produce. Thank you. Yes, take it.
Thank you, Pierpaolo. So now that my colleague has presented a little bit of a background on why it is important to focus on air pollution and specifically why we want to focus on low and middle income countries, I would like to give you a little bit of an overview of what is exactly the project of the Urban Health Initiative. And also then my colleague Abraham and myself will describe briefly the results of the Urban Health Initiative pilot project that was conducted in Accra, in Ghana. So, as mentioned before, the Urban Health Initiative was implemented as a response of the World Health Assembly resolution in 2015, and actually it is an implementation framework that aims to reduce the deaths and diseases caused by unhealthy urban environment by equipping the health sector, but not only the health sector, but other sectors with the data, the tools, and the capacity to demonstrate to the public and decision makers the full range of benefits that can be achieved from creating healthy urban environments. Then the aim of this urban health initiative, as mentioned, is to reduce the health, to reduce air pollution and also its impacts on health. And to do this, we have to achieve policy change through interventions that are based on 3 different pillars. The first one is the health evidence. The second one is health competency. And then we have the health communications. And all this urban health initiative is based in different phases. And I will briefly introduce the different phases that the urban health initiative is based on. But I will just mention that here they are represented one after the other, but actually they do not follow a specific order, and they can be applied on their own and also in a different order. But what we wanted to highlight there is the different phases that are included within this urban health initiative. The first one is the mapping of the policies and stakeholders. The second one is building competencies among the different sectors. Then we have the third one, which is on the tools. And we will go into more detail in a moment on all this. Then the fourth phase is related with assessing different scenarios and to see what are the impacts on health of considering different scenarios, for example, based on air pollution exposure. Then we have the communications to the public, the communications to the population about the results found. And finally, the changes in air quality, which is also related with policy tracking. And we'll go more into detail in this in a moment. So, as said, this also as a response of this World Health Assembly resolution, the WHO started this Urban Health Initiative pilot project in Accra, in Ghana. And for those of you who don't know the city, so Accra is the capital of Ghana, is a sub-Saharan coastal city with more than 4 million people living in there. And it is one of the fastest growing cities in Africa. And when the WHO started to implement this pilot project in the city, they were asking different questions, themselves. So the first one was, how can the health evidence be used to support the implementation of sustainable policies that reduce air pollution from key sectors? And as my colleague Pierpaolo mentioned, here is important to note how can health evidence and more importantly, the available health evidence that we have at the moment be used for that. And then how realistically interventions and scenarios can be created given the political nature of governance in a country and in a city. So having said that, now my colleague Abraham will describe the first phase of this urban health initiative.
Thank you, Cristina. So the first step or first stage of the Urban Health Initiative is to understand what the scenario is, understand the ground. And there are 2 important pieces to this, and it's to map the policies and to understand who the players are. So what did we find? This is not right. We seem to have gotten someone else's
Yeah, these are my slides.
Oh,
Oh. Oh, man. Okay.
You're giving away my presentation.
Sorry. Well, they're seeing it backwards, so it'll be
here we are.
very, very
So-
confusing.
I mean, one idea is that you present first because they probably have in a certain order.
Oh, thank you.
Thank you. What's happened?
I think they're changing it up. there.
So this is the presentation from Abraham Mwaura.
¿Pueden poner la presentación de Abraham?
O
Moment?
Cristina.
¿No?
Oh,
No
Cristina.
puede. Ah, no tiene.
Well, what did we look for? We wanted to identify relevant policies at all levels of government, so national and local. We wanted to understand the knowledge of and link different stakeholders to each other, and then identify policy gaps. And what did we find in Accra? The stakeholders identified four sectors that were key sources of pollution. Energy, and in particular household energy, and which leads to household air pollution. This is pollution from the combustion of fossil fuels for cooking and heating and lighting. The second was transport. There had been a massive development in the transport sector, basically trying to make Accra into a hub for West Africa to export goods through the port. And so it actually, there's a major highway that goes from Accra inland, and then it's linked to the oil refinery as well. The third area was solid waste management. You may know or not, Accra is one of the biggest recipients of e-waste from Europe. And e-waste tends to be processed, e-waste recycling tends to be done mostly informally. And this involves the burning of the plastic off of, you can imagine, all of these things. You burn the plastic off and you remain with the precious metals inside, the copper in particular. And then the last sector that was identified was urban land use and spatial planning. One note about transport was that we identified that the transport sector had this hidden resource that I'm doing the same thing I did last time.
You see the importance of being flexible and adaptable, and
Thank you.
you know.
Maria is my boss. So. Perfect.
Okay.
One note about transport. We identified a hidden resource in Accra that might actually be shared by many other cities. People walk. People still walk. Large numbers of people walk from informal settlements to the industrial area every day. And this needs to be protected, right? It's not about, it's not an intervention that needs to be imposed on the city. It's rather an existing trend that just needs to be protected, and people need safe, clean, enjoyable paths to be able to walk to work and school every day. So just one note of interest. Is it me? The next phase or step in the Urban Health Initiative process is to build the competencies of the health sector and these other sectors that were identified. The health sector needs to be able to mobilize other sectors, right? Because in and of itself, the health sector doesn't have the solutions. They're not the main polluters that were identified. So they need to be able to bring other people to the table and use a health argument to be able to address this issue. The other aspect is that the health sector tends to be the ones who are interacting with those who are ill, with people in the community who are facing the health consequences of air pollution. So what did we find? Well, what did we do? There are two main areas in which we worked to build capacities. One was within the health sector, training clinicians and public health workers on the impacts of health to their patients. and how to communicate these impacts to their patients, how to explain to patients to be able to better protect themselves. And the second big aspect was, I hope there's a slide. The second area was sectors outside of health, helping them to be able to understand what the health arguments are, what the health consequences of their sector are. And so we had to build competencies there to be able to use health tools in sectors where they usually did not deal with health. Which is a good segue to my next slide. The third phase is adapting some tools that were built for different contexts. So some tools that were built for European context, for example, that had to be adapted to be able to use in Accra, and applying the tools that were in general available. And Pierre talked about a little bit about that as well. So, for example, we used AirQ Plus, which is a tool to do health impact assessment of air pollution in Accra. Very straightforward if you have the right data, right? You just need the concentration of air pollution in the area and the exposure to the population. I might be missing one thing. And then you're able to understand the health burden. And we did this in Accra. The other tool that the methodology was used, but was adapted to be able to use in a global context, was the HEAT tool. This is the health and economic assessment tool for walking and cycling. With this, we found with the HEAT tool, we actually found that as many as 30,000 premature deaths could be prevented over a 15-year period from 2015 to 2030. I'm getting the numbers wrong, something like that, that number of years. And another 5,500 deaths could be prevented by the reduction in air pollution, by switching from private cars to more public transport and walking and cycling. Then we assessed the different policy scenarios and tested what the potential health impact of those could be. For example, in Accra, using the AirQ Plus tool, we found that 1,790 premature deaths could be prevented by meeting the air quality guidelines. This is the previous air quality guidelines that are now the target 4 of the WHO air quality guidelines. And this represents an economic burden for the city of $247 million. In household energy, they laid out basically the most ambitious policy scenario for household energy would be to switch to mostly LPG, biogas, or electricity as substitutes for wood and charcoal, which are widely used in the city, and actually contribute a large portion to ambient air pollution as well. In this scenario, we found 1,900 averted deaths from reduced air pollution exposure in the home, and a reduction of 35% exposure. In the transport sector, I already gave you some clues. In the most ambitious sector scenario for transport, which included increasing public transport, improving fleet fuel economy, and building infrastructure to make walking and cycling safer while reducing reliance on private vehicles, we found 5,500 averted deaths from reduced air pollution and 33,000 averted deaths from increased physical activity from walking and cycling. This results in an economic benefit, health benefit of almost $15 million. In waste, we tested a scenario where all waste burning was ended in Accra. This would lead to a 15% reduction in emissions and potentially 19% capture of landfill gas by 2050, and a small number of premature deaths avoided. And then there was an economic evaluation done that looked mostly at the transport sector, where there was a lot of evidence, but across the city at all of the polluting sectors. What we found was that there is a catastrophic cost to individuals. Most of the people who were affected came from were informal workers or people who were low income, and in some cases it was a massive portion of their annual income to go to the hospital even once for an air pollution related illness. We also found that the cost benefits of controlling air pollution are highly cost effective, a 2-to-1 benefit cost ratio. And then something that's a little controversial in Accra was the bus rapid transit, which had been funded, but never was funded. One phase was funded, but it was never really finished. And we found that had they considered the health benefits of putting in a BRT, that it would far outweigh the cost of the intervention itself. In the back, and I brought a copy just for you show and tell, we have a summary of the whole process and some of the results that we found in each of these sectors as well. Hot off the press. The next step is communications to move policymakers and decision makers. So urban leaders have to be engaged and basically understand what the evidence is saying to be able to then lobby the decision makers to be able to push for policies that reduce air pollution. In Accra, we took a few different approaches, but it was a very innovative communications campaign. One was, of course, targeting health workers and building the capacities of health workers to be able to communicate the impacts of air pollution on the health of their patients. This is with the city of Accra, very, very deep media engagement, training basically the bosses of major media houses, the editors and publishers of major media houses, as well as reporters on the impacts of air pollution. There was a series of community events that engaged traditional leaders, chiefs and queen mothers in basically to understand the issue, but also to advocate for changes. And the other group that was really targeted were informal workers, as I mentioned. And here we have an illustration of an informal waste collector, where one of the studies was done actually. And then the last step is policy tracking and monitoring action. We're just about to complete the report on this, where we are suggesting a particular framework for being able to monitor policies related to air pollution and understand their impacts. Should I keep going? No.
Thank you.
No.
Okay, now I think,
No.
okay, thank you. I will continue with this part of the presentation because as Abraham has said, so this will be, it is the most new report that will be available very soon. Now it's being cooked. And probably in the coming weeks, it will be available. So we wanted to pay a little bit more of attention here. So just a second before going to the next. Yeah. So in this report, what will you find? So first of all, in the report, you will find a description of the urbanization patterns in Africa, because, well, this has been mainly explained by Pierpaolo before, but in the report, we basically highlight this rapid urbanization of the different cities in Africa. And that is usually not accompanied by formal employment and other opportunities. And this brings inequalities and also inequalities in health. So apart from that, in the document, you will find a discussion on the potential difference between urban health and rural health, and what are the links between both, and what are the differences between both concepts. Then we also discuss about the key risk factors for health in cities, considering all what you already know, no? So the urban design, the behavioral and social risk, also the physical risk, etc. But again, focusing on air pollution. And why in air pollution? So because of the increased exposure to air pollution in low and middle income countries, which is basically because of the large and growing because it's basically because of the rapid urbanization and also because of the economic development, which is usually accompanied by the increased burning of fossil fuels. And also this related with the large and growing burden of diseases related to the exposure to air pollution. So knowing all this background information, we know that it is very important to promote the policies that will reduce air pollution and its health effects. But here, what is even more important, or what is very, very important, is to track these policies, no? Because it's not only enough to do the policies, but also to track the efficiency of these policies, to know what's working good and what is not working good, to know what can be improved, etc. So what is policy tracking? Policy tracking is the development and application of systematic approaches to identify and evaluate the planning, implementation, and progress of a policy. So the goal of policy tracking is to evaluate the status of this policy. With policy tracking, we use qualitative data, let's say, and then there's this other concept of policy surveillance in which we use quantitative data. In the report that will be available soon, we suggest an hybrid model which takes into account policy tracking, what is understood as policy tracking, and also policy surveillance. Because in this model, we can combine quantitative and qualitative data, also because these two models can complement each other. And also, as Pierpaolo has mentioned at the beginning of this presentation, no? Because this has been mentioned by Dr. Maria Neira, no? Because there's no excuse. So in this case, if there's not enough data, we can even track these policies. So the framework that we described with this policy tracking framework also have different steps. No, the first one is the policy identification, which identifies which are the policies that exist and what are the authorities that are involved on this. Then we have the policy impact that consists on conducting evaluations to determine the impact of the policy on health. Okay, and we want to know whether this impact will be significant or not, etc. Then we have the policy monitoring to identify if there's a monitoring or a surveillance process going on and understand what data we have, etc. Then we have the data collection to identify the data sources and the data available to be able to track the policies. And finally, the policy quality, which evaluates the changes in both environment and also the health outcomes. So this will summarize what is the policy tracking framework that we have suggested in this report that, as I said, will be available very soon. And finally, to finalize this presentation, and then we will have some time for the speakers of the panelists to discuss what are the challenges. No, I just wanted to highlight the main achievements of this urban health initiative, which I will go very quickly, but basically to provide the city with a wide range of analysis and scenarios developed with local stakeholders to reduce air pollution impacts on health. Then also to enlarge the discussions on environmental policies to several actors, even with those that are sometimes not involved that much. Then to create a large network of people involved in training and capacity building activities that was never done before. To give international visibility to the groundbreaking work of local experts. Also to demonstrate that in sub-Saharan cities and in African cities in general as well, a different approach can be taken on environmental problems. And this is an approach that moves from a public health perspective. And that's all. And now, yes, I will give the floor again to Carlos Dora to moderate this discussion with all the panelists here. Here we just want to acknowledge all the work that has been done by many colleagues that have been involved in this project of the Urban Health Initiative, and also the donors, which are the Climate and Clean Air Coalition, and also the government of Norway for the fundings. So thank you very much, and the floor is yours, Carlos.
Thank you. Thank you.
So perhaps, shall we start with some questions from the audience, you think? Or do you have some points to bring? Okay, so Milan will speak first. Milan.
Thank you very much. Thank you very much, Carlos. And I can see my colleagues actually use this space very effectively. I'm going to stick right next to you. I actually have some slides. Yes. So it's, thank you very much. ¿Me pueden poner, por favor, la presentación? Gracias. I've been invited on this panel to actually share some experiences that we have from the field, particularly in the region of Africa and Latin America. So I'd like to complement these approaches and findings that we have to the Ghanaian study and the Urban Health Initiative approach. I'll just wait for my slides to come up. But just a quick introduction. My name is Dr. Milan Tondu. Today, I am wearing an academic hat for this panel, but I've also worked and I continue to work very closely with the World Health Organization and also with a number of government actors in African cities. Still waiting for my slides. So on behalf today of the GDAR network based in Cambridge, I wanted to show you that we're working across 7 different sites. These sites are mainly in African cities based in Cameroon, South Africa, Kenya. We also have cities in Latin America and Brazil and also in Jamaica. Part of the work that we do focuses on air pollution, not only in terms of the data that's available, but also in terms of how much the stakeholders actually value and think that air pollution should be on urban agendas.
We are checking. It's coming.
Thank you. Thank you, Cristina.
I think they are testing your capacity to adapt to the situation.
Great. I'll still give them a couple of seconds.
Yeah, this is always nice, having a thank you slide, reminding people that.
I think in addition to the work that I would like to present that we're doing in Cambridge, I wanted to highlight that I'll present a quick case study from Mauritius, where we used the same approach, looking at health impact assessment of air pollution, adding traffic injury and physical activity. Great. So that's the introductory slide. This is the different sites where we are currently working. So kind of to bring in experiences from this side, I think is very valuable, not only in contrast, but complementary to what the Urban Health Initiative is doing. What these sites actually have in common is that they are experiencing very high levels and high prevalence of NCDs, but also high levels of inactivity, physical inactivity, and high vulnerability to climate change. So why LMICs, why cities? Of course, we do know that poorer countries experience higher burdens of death related to air pollution, but also deaths related to NCDs and traffic. What are the interlinkages that we're looking at and how this can complement the discussion today? We're looking at how health is related to urbanization and climate change. And the takeaway message from this slide is that the interlinkages between these topics and sectors is that there's a lot of backward and forward. And unless we take a very systems approach to all these different challenges, we cannot really understand what factors actually aggregate in order to make diseases worse in cities that are fastly urbanizing. What have we found so far? So we've done systematic literature reviews. This one particularly looks at 156 countries, low and middle income countries. And we've also looked at how the built environment is being addressed in these countries and whether or not health impact assessments looking at air pollution and other factors are prevalent or not. What we do find, and this actually comes to confirm what you've been saying before, is that, of course, on the left-hand side of this graph, you see all of the different sectors that are, how we would say, hot topics in trend right now. And air pollution remains the first in line, not only across the sectors on the left, but also across the regions on the right, Asia, Africa, Middle East, and the Americas. What we also see in these reviews is that air pollution remains and still is the most common pathway through which the built environment impacts on health. And particularly true, again, and I do confirm Pierpaolo's and Abraham's statements, that The sectors of transport and energy are the sectors that are receiving the most attention right now. So what research are we building on? So this is the health impact assessment that we did in Mauritius, and I can see Dr. Tiago there. We've had a couple of discussions about whether or not this was the first health impact assessment of urban and transport planning in Africa. And so we've decided that it may be, and that the Ghanaian one was the first mainland African health impact assessment. But the whole point of it is that this is a growing field. It's new. It's not yet as mainstream as we want it to be. The air pollution levels in Port-Louis, a capital of Mauritius, is nearly 4 times the recommended levels by the WHO air quality guidelines. Although we do know Mauritius to be a country with pristine beaches, good sunshine, good food. It's also the most dense country in Africa. It has doubled in urban population in the last 50 years. We've had an increase by 600% of the vehicle fleet. And this is not just Mauritius. This is most of the African cities. This is what is happening right now on the continent. In a nutshell, the HIA shows similar results to the Ghanaian one, that reducing cars is not enough. We have to look at motorcycle use. We have to focus on active travel, but more importantly, focusing on air pollution policies and transport policies will help governments save up to 20% of the expenditure that they're actually spending. Coming back to what we're doing, and I will end up in a couple of slides, 2 or 3, I think, is looking at this nexus between health, urbanization, and climate change, with air pollution as one of our main focus of interest, is necessary. More importantly, unless we co-design these research and these interventions with stakeholders, there's a lot that we will miss. What we have right now is a project where we're looking at stakeholder consultation with over 400 stakeholders, with whom we've actually interacted with over 100 in the last 6 months. And what you can see from this graph is that we are making sure that we're covering different types of stakeholders: commercial actors, policymakers, academic representatives, and community members, and this across all the different sites where we're working. These are a couple of photos. I think the main crux of this is to understand that doing health impact assessment, addressing air pollution effects on health, can only have impact if we're co-designing this with the stakeholders and ensuring knowledge translation all throughout. And we have seen really great results so far. So this will be for the discussion with Carlos, but here on the slide, you can see some of the challenges from the field, not only from primary data collection of air pollution using low-cost data census, citizen participation, but also the wider knowledge translation and policy translation of these results. Air pollution monitoring stations, of course. When I started working on health impact assessment, and I know Dr. Tony is here in the audience with IS Global, in Barcelona, they have over 1,000 monitoring stations. In Mauritius, we have 1. And it's actually placed on top of a mountain, which is considered the only green space in the city. So whether or not the data is reliable, whether we can access it, what are the affordances, is an important discussion to have. The data collection systems are very decentralized. As you know, we can have climate data that is privatized, that we have to buy. There can be environmental data that is free, that we can access, but not as stratified as we would want to. Internet connection is still an issue to collect data. I mean, we cannot continue to underestimate how difficult it is to scale data collection in air pollution, especially in vulnerable areas and with populations that are hard to reach. And of course, finally, stakeholders, political timeframes. And I know that Dr. Nera here knows of all of the intricacies of the political timeframes in terms of air pollution and environmental research. I will end on the scientific validity of these approaches. What are the things that we should be worried about? Why is it that we need to do this work properly? cleanly in a certain way. There can be a lot of selection bias in the type of materials that we use. And my apologies, I think this may be a bit small, but what materials do we use? What data sets do we access? And who accesses that? Also, what type of combination of techniques are we using? Who are the researchers? Who are the technical experts? And how are we actually expanding these knowledge out of our circles of interest, but also our zones of comfort? Finally, there are a lot of data collection errors to consider, content validity measures. There are a lot of modeling intricacies that are important to think of, particularly in our case. We had to triangulate a lot of data, official data, survey data. We did health impact modeling, but again, cross-cutting it with sensitivity analysis, making sure that the health outcomes that we're considering are actually relevant, not only from a medical perspective, but also from a political one. So what are the implications for future research in air pollution and health? I think there are many. A major one is about inequity. We do know that poorer populations are the ones who are dying most of air pollution, and we cannot stress this enough in our research, but also in the way that we translate our findings. The mental and social health determinants of air pollution impacts, the meaning of transboundary health threats, in terms of climate change effects, but also with all of the lessons learned that we are getting now from the COVID-19 pandemic. Finally, I would like to stress the point of data systems in low and middle income countries, particularly in Africa, where environmental health surveillance is really budding. I mean, it's very promising. We're experiencing a rise in interest, not only from the stakeholders, political stakeholders, but citizens. And I can name a number of urban better initiatives, citizen participation initiatives, where data is now not only for the government, not only for the experts, but also created, used, generated, and also translated by the citizens themselves. So thank you. And if you're interested in the topic, we have more sessions tomorrow on urban health partnerships and on Wednesday with our colleagues here looking at modeling health impacts in low and middle income countries. Thank you for having me.
Well, thank you. So I think you presented a lot of stuff in terms of you're talking, the questions that people have, their interests, the stakeholders, the actual data that exists, the modeling, the feedback. So there's many steps on that. So my first reaction is, how are those stories being told? How are, with the thread that links people's interests, and I think stories and also history in a way of the research in terms of how have people reacted initially? I mean, what happened? So for me, in addition of the value of having the health impact assessment done, the comparative assessments, there's questions of validity, etc. What data do you have that you brought up? What models can you develop? So there's different levels of complexity, which I find it both fascinating and very useful for us as a community to reflect upon and to learn from. So I think you packed up a lot of things. So, my first reaction is, let's unpack, let's look in detail, and perhaps let's, hear the voices of people who have been asking for this analysis in telling us, or you, what they learned from it and how they could use in their policymaking. Because I think it's all, for what I see is all the interaction and interface between the science and the policy and the political infrastructure. So I find it fascinating, extremely rich, and you also brought the other studies which don't cover specifically air pollution, they cover other NCD's risk factors but use similar methods in terms of the modeling, etc. So for me, fascinating. But my first reaction is to, what about if we were also, and you probably have done that, bring the voices in the perspective and the perceptions of people who have been engaged, perhaps as users, or the first consultations, stakeholder consultations, different groups, etc. Because if I remember correctly, in the first stakeholder workshops, the indoor air pollution was very orchestrated, well organized. So there were other people who were less organized. Some people were more interested in the data, some people were more interested in the action. So there was a lot of like life in general, right? I mean, there's a lot of interest, and it was very colorful and varied. So I don't know if you have any reactions to that at the moment, if you've also done some of that nature of work, some ethnographic, some sort of consultation, some perceptions work. Perhaps you could bring in. So that's my first reaction. But maybe I think as you present a lot of stuff, there might be other questions from the audience that perhaps we could bring in at this stage. I don't know if there's anybody who wants to put either a clarification or another question. Maybe we can kick out with that one, and then we can move forward.
A very, interesting observation, interesting question. I was, when thinking about this, I wasn't sure whether I should use anecdotes or not, but I will tell you 3 anecdotes that you may not even be aware of, even though you started the project. The first time I went to Accra, one of my tasks was to collect photos, right? Was to actually just get visual evidence of some of these sources, and I went to Chokor. Do you know Chokor? It's a fishing. This is a place that has been there for
district.
Yeah, it's a district, but the village itself had been there long before the city was there, right? These are folks who are doing the tradition, the economic activity that their forefathers had done. And one of the first people I interacted with was a family running their family business of smoking, of doing fish smoking. And I walk up to them and I ask for permission to take their picture. And the lady's reaction was so strong. So again, absolutely no way she was going to allow me to photograph her in this context. And so we get into a conversation. A few years prior, the newspaper had come and wanted to do the same thing. They wanted to take her picture of her doing this, her income earning activity. And she had let them, and the article came out. And of course, she is a literate person. She could read the article. And they had, according to her, they had cast her as completely ignorant. Right? Whoever the reporter was wrote a story that basically said, look at these poor people. They don't even know the kind of toxics that they're exposing themselves to, which she said is of course not true. She doesn't smoke. She takes care of herself. She's fully aware that pollution is not good for her. This is her livelihood, right? And I found that really interesting. In the end, I convinced her, and it took a long time, but it was really the idea that, well, you can tell your story now and it could potentially have a difference, right? Because again, there had been all these, there have been many efforts to try to modernize the fish smoking in Accra. And most people really have just not adopted it, right? They just haven't moved over. They're not convinced yet. But I found that really interesting, that particularly this connection to tobacco, right? That she herself identified, no, I don't smoke. I know smoke isn't good for me, right? So story number 1. I thought it was an interesting, this was a personal experience. I'll only give you 2 anecdotes. I'll save the third one. The second anecdote is actually from one of the community engagement meetings. right? The city of Accra, I think, had recognized, maybe without us from Geneva really fully understanding what the political dynamics were in the city, that the traditional leaders had to be engaged, right? This was not just about the city council and the mayor and kind of like bureaucrats in charge of particular sectors who needed to be engaged. They understood from the beginning the political power in the communities lies with these traditional leaders. And so they did round after round of town hall meetings where they invited the traditional leaders to come. And lo and behold, one of them happened to come from a town outside Accra one of these times. And he begins to question the EPA representative, who's actually one of the co-chairs of the project, about a particular source in his community. Just over and over. Well, what should we do if there's a source in our community that that is polluting us? Who should we call? How do we go about this? And the guy went back home, and I would say it's one of the hidden success stories of the work we've done. He went back home. They had been fighting a sweet making factory, if you can imagine. They make toffee, like, sweets. And this place had existed, this was a pre-colonial factory. It had been there a long, long time, very polluting. He called the EPA, he started calling the enforcement agencies, and he called the media. Basically, he used the strategy that he had been taught at that town hall meeting. He called the media. It was the same media representative who went there, who had hosted our launch, which is just this strange irony, or I don't know, coincidence. And this guy this media person had already been educated on these issues. He understood what the health impacts of air pollution were. And then now you have this community elder, right, who can now put the story together, right? This is not just some abstraction where he has to guess at the health impacts. He can now speak specifically about the health impacts that have been, uncovered through this process with this media person and then the EPA. And it was only, they basically came, fined them. They came and basically told them, you need to clean up. And eventually they had to shut them down. And it was just this really interesting, again, someone who had been battling without the data, right? Who had been fighting this pollution source, but then without really having the arguments, suddenly, equipped with the evidence, is able to in this case shut down a kind of illegal polluter. But I would say very interesting again.
Yeah, but you also said that waste, especially toxic waste, it was a very important source of pollution, etc. I think I'm coming back to perhaps one of the things that what brings my curiosity would be in what context this analysis were done and what happened with. So you gave a couple of stories just now, but it'd be useful to know overall. I remember there were no sidewalks, and there were, this was one of the biggest, calls for civil society. Well, let's, instead of thinking of only let's see how people can walk without being damaged, etc. I think those narratives in terms of what are the interests, how did the analysis came into that context? There's the issues to do with the analysis themselves, with the kinds of biases and sort of limitations that it can have, the data sources, but also what impact it had in those communities. So I don't know how much you have that ready, but I think that's an interesting element. Pierpaolo.
I think, your question is the most delicate one, is about the possibility to understand if what you're doing is transforming the environment.
Yeah.
And Cristina made a presentation on policy tracking. You remember when we put that in the project, there were different ways to arrive to policy tracking. But one thing that, for example, in my case, I am very disappointed to see large projects that they spend billions. They go in a country, they build highways or whatever, and they leave, and nobody knows what has happened, in the sense that you go there after a while and it's a catastrophe. There are books on the list of catastrophe projects in Africa. we did a very small project because we had, I mean, the World Bank for the solid waste management had 70 millions in 1995, 140 millions now, we had 1 million. So with our budget, we cannot do much. I have to be honest. It should be the opposite. But this is the world where we are living. I want to answer to you with probably not the expected answer that you expect, but the reality is that we are dealing at the moment with the tools and the instrument for understanding the changes in policies and even the stakeholder engagements that are old. The reality has moved much quicker than our capacity to deal with a post-political world. If we go in Accra, the mayor of Accra is appointed by the President of the Republic. So we are in a place that is democracy, and there is at the same time, you have a very authoritarian hierarchical structure. This is Accra. Then you move to another place and you have the mayor that is elected by the old citizens, but then you have an instability and you have every 2 years that they vote. So there is, for us, the level, the urban level, the government level is a level now that is not so easy to tackle. And that's why we have to move much more in a multi-scalar way. It's not just the urban, the city, it's just, it's what is there in terms of affecting the environment. And I think the last lesson that we have learned with this work is that we are moving toward a little bit different approach than the one that we envisaged when we start with, I show all the models, the tools, but the idea of policies now has changed. The fact that we have a system of powers that are very different from the system of powers that were before.
So are you working on that? I mean,
Yeah, I think in the second phase of
where's the policy practice?
We will move toward a little bit different approach. We have to we have to understand our weaknesses. I mean, our budget is limited. It's quite a shame what we have for this project. We spend every single penny of the million that we receive, everything. We save it, we could, but the other point is that, okay, we work in conflict in places where, if you see now what is the municipalities and the governments and the whole structure, the process of governance is going, it's a process of conflict. So we must be aware of this. And it's a little bit different way of saying, look, this is the scenario. No, we have, as WHO, we have also to think, okay, we enter in a conflict. Before, people were saying here, the person was sitting here, if we produce a policy that will be associated to a particular interest or a particular, yes, now more than ever. So we have to change also the way to communicate. We have to say to people, look, we are doing these projects and we want to follow up what's happening. And this is already you're touching the interest of people that they say, we like the way many donors and people do projects here. They come, they spend $1 billion, they leave. So this is already a problem when now we are selling this approach, also with the policy tracking that we have already implemented in Accra. There are some issues, obviously. It's not that everybody wants to see what has happened if they follow your suggestions. And I want to add something here. Okay, we are quantitative people. I'm a spatial analyst, a statistician, but I am very aware of the way the tools are developed, and I'm very aware where they're used and who are the people that are using that. I'm saying this because in Accra or in Africa, we had to face a colonialism and post-colonialism attitude of many donors, agency, and this is a political issue. I can give you 1,000 of examples where I saw big donors just selling their technology, their knowledge, and not empowering anyone there. And this is happening everywhere in Africa.
Good.
Okay.
So let's open to, if there's any questions or comments in the audience. We have a few minutes. Yeah, I think we have 5 or 10 minutes still. Are there any burning questions, comments?
I can add a comment to your question. Carlos, maybe if you allow me to I feel like one of the listeners more than participating here. So my question will be, okay, this has been an enormous effort. This has been done to respond to questions that we all have as an international community. So the question to all of us is, what next? How these tools can be used by whom, and how we can make sure that this knowledge will be now operationalized and implemented and definitely incorporated in many of the practices of what we are discussing here about urban health. Can this be a tool that will be incorporated for air pollution, but maybe for other purposes as well? And what are the lessons of that, and whether we see it as something that doesn't need to be replicated in other areas and can be used as models for and this is a question for all of us, I mean, including the participants here that might be working on projects of this type, whether this is responding to the questions they have it or not, or we still need to keep, I'm asking you as well.
Well, I think you're absolutely right that in the way that the fact that this way of working, building scenarios around air pollution, the sources, and proposing, different alternatives on the basis of what the health impacts are, etc. I think there's obviously a very, it's a core which is very appropriate, because we're using evidence on air pollution and the knowledge between air pollution and health impacts in building scenarios which respond to the local sources. But there's all this context that we're talking about and where these questions are. Can this be made use of? And I think for me, the interesting questions today is exactly what are those, what have you learned, what you could do different, partly because there's many other people starting to do that exactly model that was used in Accra before. So I think those questions merit a lot of reflection and, to be perhaps revisited in that way. If you were starting today, what would you do different? And how would you frame or reframe the project or that type of project? And I think that draws also in the work that you're presenting, Mila, in terms of the scenarios comparison, etc. So I think that's, for me, very, very viable, just because many other people are starting that today and using, the same assumptions and putting the question in a similar way. So I think that's a very important point to
very quickly, Carlos, and then
yes.
Milan, go.
Sure.
I'm very quick.
Yes.
I think we start a project just taking all the available data and that's it. I think now if I have to start a project, I would push to build some data with the local people where you gather data. So you build a kind of awareness of the need to measure and to have some information. That's something that I think it was okay when we did it, and it's still valid because you save money. You cannot do a big research with a sample, a cohort study in Accra. It's too much expense. But this should be reconsidered, I think.
Super. Mila?
Thank you. Thank you, Carlos. Thank you, Pierpaolo. I think I would just respond asking a question to the audience, actually. I was reading a paper not too long ago about policymaking and the impact of evidence on policies and interventions. And maybe would somebody be able to estimate in a country like South Africa, what percentage of policies are currently designed using evidence? If you had to give a percentage, any percentage. Anybody? How much? 2%? Okay, anybody else? Actually, you're not too far. Currently, in a country like South Africa, but other similar settings, and I don't want to overgeneralize any type of African settings because each African city is different. But in South Africa, only 5% of all urban policies are currently based in evidence. And I think that talking with stakeholders, but also with citizens, there is a big gap because we have to create that demand for evidence even before having it. People can have the evidence, but we don't know how they understand it. Mostly, we don't know how they communicate about it to their peers. And finally, we don't know how they use this evidence to empower their own health. So joining what you say, working bottoms up, not only to create the data, but also create the demand for evidence on the other side, and joining these from two sides is super important. And I would say I would end with that stakeholders often don't want evidence, they want solutions. And we are talking a lot about evidence, but there is still a gap between how this evidence is used, but also what solutions it can actually trigger from a practical perspective. So thanks.
But in a way, the models are around solutions, right? You're
They
looking
are.
at the sources, and you're going to potential solutions, and then you model. So in your work that you're presenting, I mean, on reflection, what adjustments would you be making, or would you, where's your,
So
is this the stock taking?
yes. I think that there's many strengths in working in a small island developing state. The first one is that it's a very small sample. So I can comfortably say that the health impact assessment that we did led to a metro intervention. So a real push from the government based on the impact assessment results to focus on public travel, to decrease highways, to actually create this metro that across the whole country. It's easier because it's a small population. It's a project that had nationwide impact. So what I would do is scale this up with the actual challenges that a city like Accra faces. I mean, Accra is bigger than the whole population of Mauritius. So using these practical, but also successful impact assessments in smaller settings, but that are much more participatory, right? Because what we were able to do is to co-design from the get-go. That is, we chose, for instance, we asked the stakeholders, do you want to look at air pollution? And everybody was like, yes, yes. And then we asked, do you want to look at heat? And I'm coming from a country where it's hot. And they were all like, no, nobody works on heat. Nobody dies from heat. So the air pollution drive was very strong. There was a lot of impetus to work on it. And this from the first day until the last day where we used the results and trained them in health impact assessment. So short answer, scalability. Yeah.
Very good. So I think we have a reception starting in, I think we went over, right? And we were supposed to be finishing at 6. So I think we have 2 strong take-home messages, and we have still one question there. And one in the back.
I know everyone's wanting to run off to the reception.
Speak close to the mic.
Oh, okay. I just wanted to ask a question, just coming back to the whole evidence versus solutions for stakeholders and decision makers. And how do you kind of balance that when you're doing the research? So you were presenting some of the findings from Accra, and you were saying in the most ambitious scenarios, these are our findings, and this is what we would estimate the impact would be. Do you take those very ambitious conclusions to decision makers, or do you kind of say, more specifically, if you want a solution, here is a kind of intermediate scenario that you could kind of put into place, and then this is what we would expect you to see? How do you kind of balance that?
Maybe the other question, because we will have to wrap up, so we can take the 2 in a. So presumably you have to talk about what you model, right? But maybe you modeled intermediate solutions as well.
Hello, very nice presentation about the work that you have been conducting in Accra. My question was basically how important was that the policymakers were involved in the whole process? And if you wanted to translate this model to other countries, whether you can start from academics, from the grassroots, from citizens, or it's really important that you also involve policymakers in the whole process. Thank you.
Cool.
Very quickly, and yes, we gave all the results to the policymakers, and the model the scenarios were discussed based on the real policies and real possibilities, like stop waste burning. It's very ambitious, but it's something that can be done. It was done in other countries, so it's not something that is crazy. And this creates, as I was saying, some tensions, I would say, because the policymakers are not going linearly toward sustainable solutions. They are going toward a very much more complex, they have conflict of interest. There is a lot of different variables that you cannot control. But we try to follow all the policy that could be implemented in reality and not to invent things that were unreal. Even in modeling air pollution in an area where you have a season of desert dust from Sahara that is very heavy, you can work on the not only on the peaks, you can work on the average, you can work on the anthropocentric sources of emissions. I mean, the discourse was very hard with them because we participated to the discussion of their quality standards, and there was a lot of excuses related to the fact that it's natural dust coming. And so this is just an example. On if we can replicate what we do, this is something that I don't think we can replicate things like this initiative as it is everywhere. This was a case. It's a medium-sized city. It's quite a place where there is a university, where there is academic people. There is a debate. It's a stable democracy. So if next time we go to a country where there's a post-war situation, where there's no data whatsoever, we cannot implement the same. That's why I was saying before that we have chosen a pilot case study that we could, in a way or another, address between the worst situation and the best situation. But probably next time we will move in the worst situation, we will go in a place where we have really no data, and we have to work in a completely different way. This model works, I would say, for a lot of different places. But you have to contextualize what you do. I think that's the lesson learned also for the models, for the tools. Infinite discussions about why using some relative risk based on cohort that were followed for ages, in North America or in Europe. People were saying no. And you have to address a lot of cultural barriers also in this, and we are not exporting, I would say, any information. We are building a knowledge with the people.
Do you want to comment? Yeah.
I wanted to make one.
So brief comments, because
Yes,
I have
very
to
brief,
open
30 seconds.
I have the vice mayor arriving, but this is very interesting and very relevant. So let's go there.
Very brief. As Pierre mentioned earlier, with Cristina and others at WHO, we've really been wrangling through the last few months with these questions of the shifting policy landscape, let's say, right? I just wanted to make one observation that on how we have presented the project so far. It presumes that health is an externality to the policy ground that has to be integrated into it. But implicit in that is that policy ground is already fragmented, right? And I think when it's very hard to show this on a slide, and you see how nicely like our steps go from step 1 to step 2. This is not, I mean, that doesn't represent any city, really. There's no place like that, right? That we can just say, step 1, do this, step 2, do this, and then at the very end, step 6, oh, you monitor your success. That doesn't exist. Actually, in many, many cases, it's not just fragmentation from health, so that health needs to be integrated into the urban political ground, but everything else within the urban political ground is fragmented from each other, right? This is actually in the earlier panel, integrating these pieces was put forward as one of these challenges that needs to be addressed. So with that said, I would say health may actually be an opportunity to be able to, this is what I would say I've learned from this, that health can truly, you can bring people together. You can bring people who don't talk to each other, right? You'll find within the EPA, the climate guy is not talking to the air pollution guy, You can bring them together with health. That I would say is my last
To
one.
be fair, you have to have a plan, right?
You have to have
With
a plan.
1, 2, 3, 4, 5.
Yes.
Yeah.
You take it
I
from
maybe
an
doesn't work.
idea to intervention. Yes, you still need, yes.
Yeah,
you
you
still
have
need
some ideas where
yes,
you might be able to go.
yes.
Miller, last wait.
Yes, yeah, thank you. Thank you very much. A great note of coalition there, Abraham. I think it's very relevant. I would like maybe to merge the three questions, maybe from Dr. Nera as well. The existing tools, and I can speak here for the WHO tools that I know very well, the AirQ Plus tool, the HEAT tool that has now gone global, that we've worked very hard to make sure that it's applicable to these settings that you're mentioning, the settings that are hard to work with, where there's no data, but where also the political situation is not ripe for this. And the importance of contextualizing this type of work in ready to be flourished situations cannot be understated. So therefore, I do think that the tools that we have now are enough, more than enough, to be able to look at air pollution in the context of waste, air pollution in the context of transport, but also to kind of think of evidence and solutions as being partners in crime, right? When we speak about it in a dichotomized way, but in reality, they go together. So finally, I would say in these terms, the Urban Health Initiative has been a pilot project that has attracted a lot of attention as well, not only from the research world, but also from the policymakers world. And we underestimate that health and environment, these linkages are still not very well known. So this is a success story. This is.
Yeah, this is brilliant.
Very
So
nice.
can I thank you all very much for having done all this work first, but two, of being so honest and so, reflective about where it's gone, what you could do different. And I think that's rare. I think it's unique, and I think it's very necessary. So I think a big round of applause for people who do stuff, but also think critically about it.